Hello, everyone. This is Kevin Doherty speaking from Calabash, North Carolina. If you are not aware, my wife and I moved last year to Calabash. Calabash is located along the North Carolina coast, about 60 miles south of Wilmington, North Carolina, and 10 miles or so north of North Myrtle Beach, South Carolina. My son Johnny is attending the University of North Carolina at Wilmington, and the three of us are very happy here in North Carolina. But I must say, the reports of my retirement have been greatly exaggerated. I am still working, and I'm very excited about this first webinar. In fact, the event was overbooked. So I'd like to thank anyone who is listening to the recording of this webinar after opting out of the live event. I appreciate your help. A couple of housekeeping items for the live event. Participants, you are in a listen-only mode. If you'd like to ask questions, you may use the control panel for GoToWebinar. It should be on your screen now. You may need to click on the red arrow, and when you do, there will be a section for questions. You have the opportunity to type a question or comment to me, and it will post to my computer screen. I'll do my best to answer all the questions during the question and answer session at the end of the presentation. If I do not answer your question, I will email you with an answer. So with that, let's get started for the webinar for July 26, 2019. We're going to discuss 4 topics today: simple ways to save on your prescription drug plan costs outside of the annual election period, planning for the 2020 annual election period, the elimination of Plan F for Medicare beneficiaries, new Medicare beneficiaries in 2020, and international medical coverage for trips outside of the United States. So again, these are very simple ways for you to save. Are you using a preferred pharmacy? Your prescription drug plan likely has preferred pharmacies, standard pharmacies, and a mail order option. You will maximize your savings if you're using a preferred pharmacy. If you don't know, you can check the information that was mailed to you by the company, the document known as the Summary of Benefits, also on any Medicare report I would have sent to you during the last election period. Of course, you could contact the insurance company, or you could email me with your plan and pharmacy to ensure that you are using a preferred pharmacy. So with Envision, which is a very popular plan, you see the preferred pharmacies, CVS, Giant, Harris Teeter, and others, and the Envision mail order pharmacy. The Humana Walmart plan, as the name suggests, Walmart is a preferred pharmacy, also Sam's Club. There's no other retail pharmacy which is preferred for the Humana Walmart plan. However, the Humana mail order pharmacy is preferred. And the third option, the SilverScript Choice Plan, CVS, among other pharmacies, are preferred, and the SilverScript mail order pharmacy. Another simple way to save is to purchase 90-day supplies. Now, if you're using mail order for the vast majority of medications, you would receive a 90-day supply. There are exceptions for expensive medications, such as specialty drugs. But did you know that you could purchase 90-day supplies at preferred pharmacies for most prescription drug plans? And most companies provide a discount. Now, again, I'm listing the preferred pharmacies for some of the more popular plans, but you could check. You may be able to purchase a 90-day supply with a discount versus 3 30-day supplies. And as an example, I have called up the plan for the Envision RX Plus. This is a page from the 2019 Summary of Benefits. I'm going to highlight for you with a pen here the cost. So we're talking first about Tier 1 preferred generic drugs. Well, if you use a preferred pharmacy for a 90-day supply, you'd receive the prescriptions for $2. Now, I understand that's not a significant savings versus 3 $1 co-payments for a 30-day supply. But I do want to point out that if you're comfortable using the Envision mail order pharmacy, you'd receive Tier 1 preferred generic prescriptions with a zero copayment. If you're using a standard pharmacy as opposed to a preferred, you could be paying as much as $57 for a 90-day supply. All right, let me move on to the Humana Walmart plan. So with Humana, if we look at the preferred options, you can see that Tier 1 co-payments are $3 at a preferred pharmacy for 90-day supplies, right here. Not working. Right there. All right. And if you were to use the mail order Humana pharmacy, you could see that you would pick it up with a zero copayment. And if we move to the Tier 2 options, which are right here, you'll see that at a preferred retail pharmacy, a 90-day supply would be $12, whereas if you were using the mail order, you would lower your cost to $8. So again, just simple ways for you to save on prescription drug costs. Let's move to one more, and that's Silver Script Choice. I won't use my pen, but you'll see that Tier 1 co-payments, you would receive 90-day medications for between $9 and $27 at a preferred retail pharmacy, or zero at the mail order. Now, if you're using a standard pharmacy, your costs would be $21 to $30. So that's significant savings if you're comfortable moving to mail order with Silver Script. Another way to maximize your savings is comparing your costs with GoodRx.com. GoodRx is a website. You can access it with www.goodrx.com. And there you can see pricing for medications. Let me give you an example. Someone who has the AARP preferred plan taking trazodone using CVS during the initial coverage period for the medication has a copayment of $20 for a 30-day supply. Using GoodRx, going to the website and printing a discount card would allow the person to purchase the same medication, 30-day supply at CVS, for as low as $3. And gentlemen, generic Viagra, anyone being prescribed this knows it is not covered by the prescription drug program. However, there would be significant savings with GoodRx.com. So let me use my pen here to show you that we're looking at generic Viagra, 100 milligram, 30 tablets. And look at these costs. It can be purchased for as little as $22.97. Now, this is a screen print from GoodRx, which I took just a couple of days ago. Gentlemen, you could be paying as much as $500, $600 for the same amount if you're unaware of these options with GoodRx. Here's a true story. A client of mine was in a CVS attempting to fill generic Viagra. He called me, and I had to give him the bad news that generic Viagra is not covered by the prescription drug program, and he was quite upset. CVS was asking for approximately $350 for a 30-day supply. Just using GoodRx, I was able to let him know at that same CVS, he could have the 30-day fill for approximately $100. And I was able to email him the discount card. He called it up right on his phone, and right there with the pharmacist, he received a $250 discount. If he were willing, he could have gone to a different pharmacy and paid as little as $25 per month. So GoodRx could help you save with your prescription costs. Lastly, if you are a Maryland resident and you have lower income, you may qualify for the Maryland Senior Prescription Drug Assistance Program. Now, the program does require Maryland residency to be proven for at least 6 months, usually with a driver's license copy. And with the tax return, you would need to show that as a single filer, you had income less than $36,420, or as a joint filer, income less than $49,380. And if so, you'd qualify for the program. What's most important with this program, as opposed to federal programs, assets are not factored in. So someone could own a home, have assets, and other than the income or capital gains from those assets, the assets are not factored in. So it's a little easier to be eligible for this program. And if so, the program will pay for up to $40 per month for a drug plan premium. So someone who has the Silver Script Choice plan, which has a premium of over $30, wouldn't have to pay. The state of Maryland would pay the premium for that Medicare beneficiary. And perhaps more importantly, the Medicare beneficiary would have one special election period opportunity. That means that there's a change in medications during the year, which results in higher than anticipated costs. Medicare beneficiary participating with the drug assistance program would have one additional opportunity to make a change outside of the annual election period. Second topic, planning for the 2020 annual election period. I can't believe it, it's coming up once again. I will be forwarding my email entitled It's That Time of Year Again, and I'm planning on sending it on September 30th. The review request form will be attached. I also want people to know that the insurance companies are required to send information regarding the current plan for 2020. It's a process known as the annual notification of change. WellCare, for those of you that have it, has already started to send information about 2020 plans. This information is required by Medicare. And again, it's regarding your current plan and how it will operate in the new year. It goes out prior to October, which creates some confusion because the plan information for 2020 is not released to the public until October 1st. So I cannot comment on any information, any plan, until October 1st. And the Medicare website, which is what I have been using for prescription drug plan reviews, will not be loaded with 2020 information until October 1st. That is why I send out the review request form on September 30th. Very important for this year. With my wife, I have formed a company, KMD Insurance Associates, LLC. And for purposes of the annual election period, the incredible volume of requests that I receive, I have partnered with URL Group. URL Group is staffed with licensed agents. If you forward the review request form to me, you'll be authorizing me to forward the information to URL Group to complete the reviews. Again, URL Group is staffed with licensed agents. I may not be personally handling your review if you forward the review request form. Speaking of the form, it is mandatory. Please, no exceptions. This is a Medicare compliance issue. The form is required even if your medications haven't changed. If you email me your listing of medications, I will need to reply with the form attached, asking you to complete the form. Many people sent me a text with their listing of medications. I cannot accept that. The form will be mandatory and a signature for the form. So it will need to be printed, completed, signed, and then you'll have the opportunity to either mail the form back to me or scan it. I do not offer fax because unfortunately the quality of the fax is usually such that I cannot read the medications. So please help me help you by returning the forms. And as in past years, Medicare reports will be emailed to you. Third topic, the elimination of Medicare Supplement Plan F in 2020. Many have called me regarding this. I seem to have frightened some people about this. Well, the Plan F is being eliminated for new Medicare beneficiaries starting in 2020. Anyone new to Medicare in 2020 or later will not be allowed to enroll in the Plan F. Now, if you are an existing Plan F holder, you will be allowed to keep that Plan F, of course, as long as you pay your premiums. You will not be terminated. If you'd like to make a change, you may do so at any time. There is no annual election or enrollment period for Medicare supplement plans. If you'd like to make a change, you may do so at any time. However, the insurance company will ask health questions in most cases. So you need to enjoy sufficient health in order to be eligible to make a change. If you feel that you're paying too much for Medicare supplement, you may have the opportunity to make a change. AARP United Healthcare members may change to any available plan offered by United Healthcare. This is an exception to the rule. United Healthcare permits movement among Medicare supplement plans for its members, but it does not include Plan G. So anyone who's interested in Plan G with United Healthcare who currently holds the United Healthcare Medicare supplement plan would need to disclose information about health to obtain Plan G. But if a Plan F member with United Healthcare were interested in perhaps a Plan N with United Healthcare, based on the current company practice, that change would be permitted without disclosing information about health. United Healthcare is the only company, to my knowledge, that allows that movement without requiring evidence of insurability. I want to repeat, Medicare supplement plan changes may be requested at any time if health permits. Remember, folks, the plans are standardized, so the insurance is exactly the same among all of the carriers. The rates vary greatly, however. So if you feel that you're paying too much for Medicare supplement, if you would like for me to review it, please contact me. The best way to reach me is via email, and I would schedule a time to call and we can discuss it. If you have major health issues, unfortunately, you will likely be ineligible to make a change from your current coverage. Okay, the final topic today, international medical coverage for trips outside of the United States. Did you know Medicare does not provide any coverage outside of the United States and territory? However, if you hold one of the popular Medicare supplement plans, such as Plan C, Plan F, a high deductible option for Plan F, or Plan G, it provides a foreign travel emergency benefit. This benefit is for $50,000 of lifetime protection during the first 60 days of a trip. There is $250 deductible applicable and 20% coinsurance over the deductible. But most notably, evacuation coverage is not provided. Now, evacuation doesn't necessarily mean you're on a safari and need to be evacuated. If you're on a trip to Europe, for example, and you become ill or injured and on an emergency basis need to travel back to the United States, the foreign travel emergency benefit will not cover that. So please, if you're leaving the United States for a trip, consider purchasing international coverage. It's low cost. It's easy to quote. In fact, I have a website now, new and improved, kmdinsurance.com, where you can quote the information. In fact, let me show you. I'm going to bounce out of my presentation here and go to the internet to show you. Here we go. There's my website. All right, it's very easy. You would just type in kmdinsurance.com on your browser, and my screen will pop up. This is my new improved website, and you can click on Services or highlight Services and click on International Medical Coverage. That brings up a page here, International Medical Coverage, where I give a brief discussion. And if you'd like to quote the plan that I use, which is known as the Globe Hopper Senior through IM Global, you click on that bar, and it brings up this information. If you'd like to see plan details, well, you can click plan details, and you could look at the benefits. You could click, and a sample contract will pop right up for you. hopefully faster. There you go. So, and if you're interested, this I think is the most important benefit, $250,000 for emergency medical evacuation. So back to a quote. So let's say someone contacts me, 75-year-old male, who is going to be traveling perhaps on Saturday, August 10th, and returning on the 24th. See how easy this is? The person is a citizen of the United States. And let's see, where is he going to be going? So many choices. It could be Aruba, Jamaica. Ooh, I want to take you to Bermuda, right there. And if you're on the line, you're enrolled in Medicare, and you most likely have a Medicare supplement or Medicare Advantage plan in place. And see the prices. Simple as that, folks. So for this 15-day trip, $1 million of coverage, $250 deductible, cost would only be $144.75 for the best coverage available. Higher deductible would lower the cost. And if interested, just click on the dollar amounts and up pops the application. Complete the application and instantaneously you would have the coverage. So it's very easy. Please consider it if you are leaving the United States. All right, so let's go back to the presentation. And here's my contact information. As I mentioned earlier, my wife and I formed a company, KMD Insurance Associates, LLC. I'm still your Medicare man. I have not retired. Yes, I moved, but I have not retired, still working with the email address and my web address. Now, my wife and I have hired our first associates. We are having a little bit of trouble with training, however, but we're working on it. There they are, Gumby and Red. Gumby is on my left, Red is on my right. And ladies, these are rescue dachshunds. And Gumby, we rescued just a few years ago. He has no teeth, and that's why he was renamed Gumby. Red on the right, he has molars and 2 fangs only, and 1 fang hangs out, so I like to call him Nesferatu. So anyone who's ever called me during business hours and heard some barking in the background, these 2 are the culprits. Well, that wraps up the presentation portion. I will stay online to answer any questions, which I'm about to review. If you've had enough, please feel free to terminate at this time. A recording of this webinar will be posted on my website. I expect to have it posted by Tuesday. So if you're terminating now, I appreciate your time. And if you'd like to stay on for questions and answers, please do so. And I will move to the questions now. Several questions have come in. One, will the PowerPoints be available after the webinar? Well, I'm actually going to post the whole webinar. It'll be available on the website. If anyone would immediately like a link, just please send me an email and I can forward the link with the recording. Next question. Does every insurance plan have preferred providers? WellCare seems to list only their participating pharmacies. None seem to be more than others. Candidly, I don't represent WellCare, but I could look into that. The person who asked this question, the name did not post to my computer. If you could send me an email with the plan that you have. WellCare has 3 plans, WellCare Value Script, WellCare Classic, and the WellCare Extra. And let me know which plan you have and the pharmacy you're considering or that you are using, and I'll let you know if it's preferred. Liz has asked, how far in advance do I need to apply for international coverage? The day before, candidly, so that would not be a problem. And all you need to do is either use my website or you could email me with the dates of your travel and where you're traveling to, and I could forward quotes to you. Next question. Oh, so cute. We have rescued Yorkies. Thank you.
If you purchase traveler's insurance when you travel outside the U.S., do you still need to purchase international coverage? Well, candidly, I don't know. I don't know the details of the travelers. And what I was referring to during the presentation was international medical coverage, not trip insurance. So the international medical coverage that I offer doesn't include trip cancellation. The real point of bringing that up, or points, were that Medicare doesn't provide the coverage outside of the United States, and many people rely on the foreign travel emergency coverage, which does not include evacuation. So if your traveler's insurance includes that, then I think you're just fine. Can you buy evacuation insurance without the international medical coverage? Not to my knowledge. No, it's a benefit that's included. That was marked. All right. Is there an international plan that is yearly versus each trip? I may travel out of the country several times a year. Thanks, Kathy. Kathy, yes. It's usually not cost effective, however, because if you're purchasing insurance for a period of time where you're going to be in the United States, candidly, you may be overpaying. But that is possible. It's a different plan. Your full name didn't post, but if you contact me, I can run a quote for you with I Am Global. How far in advance? Again, anytime. I think, it appears I have Humana, not Humana. Walmart is Walgreens preferred for Humana. Humana has 3 plans: the Humana Walmart plan, the Humana Preferred plan, and the Humana Enhanced plan. Whoever asked the question, your name did not post for me. So again, if you would send me an email with the actual plan that you're on, and I can check to see if Walgreens is preferred for you or not. All right, right now, that is all of the questions. Oh, okay, Kathy, I see your last name now. All right, so we have a couple more minutes. Any other questions? Just feel free to post it. I'd also appreciate it if you would let me know if you enjoyed this seminar. You could use the same question feature on the webinar, or you're welcome to email me. Or if you have a topic or topics that you'd like for me to cover in the next webinar, I'd really appreciate the feedback. Obviously, this is the first webinar that I'm running. Oh, here's a Sylvia, thank you very much for the kind words. Oh, here's a question. Is there a charge for GoodRx? No, there is no charge. It's a website. You would just simply print the discount card. A couple of nice comments. Thank you very much. I'll hang on. We have another minute or two. So again, any questions, just let me know. Go ahead and post it. Ooh, getting a lot of nice comments. Whoever wrote cute puppies, they are not puppies. Those are old men. One is, I believe, 12, and the other is 11. So, thank you, whoever wrote this. For mail order, do I contact SilverScript directly? Yes, if you're interested in mail order for your current plan, you would contact the company directly. The company would forward you the information about mail order. Your doctor or physician's assistants would need to put the prescriptions on file with the mail order house of the particular company, and then you'd be able to control it, ordering either over the telephone or online. But of course, the prescriptions will have to be put on file at the mail order house. Ooh, a lot of nice comments. Thank you very much. What Medicare plan are your old men on? I think I'm putting the vet's children through college. I can tell you that. Okay, so I think that's it for now. Thank you. Oh, wait, very helpful. I'll look into international coverage. Okay, Ross, thank you. So, all right, well, we're about a minute early from ending. For everyone who is on the line and stayed on the line, thank you very much. If you have any additional comments or questions, just please email me. And again, a recording of this webinar will be posted on my website. And based on feedback, I'll let you know when the next webinar will occur and what the topics will be. Thank you very much. Have a great day today.